Good afternoon, everyone who's watching this through Zoom and through YouTube. Thank you for joining this event that we plan to organize at least once a week, having experts from our friendly neighboring countries in Southeast Asia and East Asia, the countries that we thought to be quite successful in their efforts to tackle the COVID-19 problems in their own country. So we want to learn. And this is the second webinar that we organized. Last week, we had Professor Tiki Pangestu from the National University of Singapore speaking about the experience of Singapore. And today we have Professor Gil H from Daegu University. Thank you, Professor Gil H, for agreeing to do this. And we got help from our great ambassador in Seoul, Pak Dubes Umar Hadi. Thank you, Pak Umar. And we will hear from Pak Umar Hadi as well about our embassy operation in Daegu, because there are a substantial number of Indonesians living in Daegu. And our embassy there was trying very hard to protect and to help Indonesians who happen to be in Daegu. As we know, Daegu was the epicenter of COVID-19 the cases in Seoul. And today, I'm not going to moderate. Andrew Mantong, he's a senior researcher at CSIS. Andrew is our Korean guy. He's studying Korea more than anyone else at CSIS, so he will be our moderator today. Andrew, microphone is yours.
Thank you, Pa Phillips. Good afternoon, everyone. My name is Andrew, and I'll be your moderator for this afternoon event. Hello again, Ambassador Umar Hadi, Dr. Park from Daegu University. Before we begin our discussions today, I would like to read again a bit curriculum vitae from Professor Gil H. Here, he serves as the associate professor at the College of Public Affairs at Daegu University, and he's been experienced in researching development and environmental economics, smart city and urban disaster management. And he also leads the Regional Economy and Policy Institute that publishes Regional Economies and Policies, or REPI. The Institute has published papers about epidemic and disaster management policies since 2016. This is a very fortunate event for us, and we are honored to have you talk here and share the challenges and experience in South Korea regarding the efforts, the national efforts to deal with the COVID-19. The discussion would be very timely and would be very relevant for us here in Indonesia, as I think we still figure out the kind of policy and the governance structure that will be deployed by Indonesia to deal with this COVID-19. Without further ado, I think we welcome Professor to give your presentations for about 20 minutes. Please, time is yours.
Yeah, of course. Thank you. Okay, thank you for participating in this presentation and talks, international talks. Before we discuss about COVID-19 crisis across Korea and Indonesia and all over the world, I would introduce some important experience and lessons from Korea. Okay, next slide. I will talk about firstly Sun Tzu, and then after that I will talk about sensitivity, from sensitivity to attention, especially public attention. And I will briefly, but in some detail about some points, from case testing to dropping. And for about 4 keys, I'll one by one summarize the important issues, and then we'll proceed to discussion. So I will talk about Sun Tzu first. 2005 years ago. As you know, Sun Tzu is a very famous strategist. This image is from Wikipedia. So, you know, Sun Tzu is very famous in Asia. For example, this picture is taken in Japan. So probably, although you are almost familiar with this maxim, he said, with knowing our enemies and knowing ourselves, we will not be imperiled in 100 battles. So in last COVID-19 CSIS round table, it is made by Professor Chu in the National University of Singapore. He introduced Donald Rumsfeld's famous remarks. So I'll talk about it next slide. Yeah. Next slide. Yes, thank you. So about COVID-19, we do not know where it variantly comes from, but knows partly where and how it has come, but still remain unknown without early attention. So it is both unknown, known, and unknown, unknown. By unknown, known, I would like to stress we need more public attention about the known. But at the same time, we do not still know because it is a virus. It can vary. So, and I'd like to emphasize the other aspects, unknown, unknown. This is the aspect of emphasized by Donald Rumsfeld in his news briefing 2002. So I think this two approach to understanding COVID-19 are important. So I'll talk about it with this perspective, COVID-19, in next slide. This graph shows the trends of COVID-19 confirmation. You know, this is from the New York Times. And this graph shows, for example, South Korea, it takes how many days to reach 2 times confirmation. So this graph shows South Korea is flattening the curve of confirmation, COVID-19 confirmation, very dramatically. And, you know, our first confirmation was found in January 20. And then after that, the cases had not increased abruptly until only mid-February. But you know, around mid-February, cases has rapidly increased. This was actually due to some app made after the 1,000 people gathering in a building in Daegu. That was a very you know, last February was the hottest months, one of the hottest months in South Korea. But after that, South Korea has tried to flattening the curve, and actually we experienced the extreme, the threshold, more than 19, around 19 cases one day in February 19. But you know, recently, I see today's the case number yesterday, 27, and the total confirmation up to now is 10,564. until yesterday midnight. But you know, actually, I'll show you this graph in the next slide more in visible form. This is the almost same graph, but it is provided by BBC, not New York Times, but it is show the similar flattening curve. But we should still strive to struggle with COVID-19 because although it is flattened, but it is still increasing, especially all over the world, and especially in Europe and the United States. But so I think public attention over the globe is still needed. So I will talk about it next slide. This is the graph provided by our world in data. So, you know, I think, and many policy analysts and infectious disease analysts, you know, I'm not infectious disease expert, but the government policy analysis expert. So in this regard, I'll talk about this. Firstly, tests are evaluated to be very important. So in this graph, you can show, in this graph is made as of March 17. But until this day, South Korea's cases performed test cases, it has reached almost comparable South China, Guangdong. But, you know, I think this first time measure to combat COVID-19 is very important to flattening the curve in Korea. The similar graph, but I talk about the next slide in another graph. In another graph, we can see, you know, COVID-19 test per people, precisely per million people. So you can see South Korea has conducted many tests, and I think, and many experts believe this was the first key of Korea's recent effective combating COVID-19. So about this effective combating, I will talk about how Korea has made such kind of effectiveness. I'll talk about it in the next slide. I think we need to be more sensitive, but more learning. So we are actually learning from this global crisis. So government has led public response, but we need to know and we need to learn. So COVID-19 is a very strong stress over the globe and strong fear. But Korean central government, and especially Korean CDC, that is Korean Center for Disease Control and Prevention. So Korean central government and KCDC tried to lead a public response, especially try to change the stress and fear to public attention and social learning. So because many citizens in global are familiar with already many ICT, information and communication technology assisted collective intelligence. So in the end of this presentation, I'll introduce some cases, Korean cases. So, you know, because this kind of stress is very dangerous and very strong, to many citizens all over the world, but we need to know and we need to learn. So for this, Korean government has provided public information screened data, some traffic of confirmation, confirmed cases, confirmed patient, but Korean government has screened public information. But and some private company freely, without charge, developed some good apps to be cautious visiting such kind of formal traffic of confirmed patient. I will talk about it in next slide. Not this, but around the end. Actually, South Korea has already experienced SARS 2003 and H1N1 2009 and MERS in 2015. I will dichotomize these line in this line. You know, exposure, screening, isolation is probabilistic or statistical concept, and systematic, but infection, testing, and treatment is policy or political and scientific. So, but in these two dimensions, we need cooperation. So, actually, in Korea, scientific and medical experts give many advices. Although such advices is not 100% accommodated by the government, but you know, there was KCDC. So there are many experts in KCDC in infectious disease. So I think the gaps between some political and the gaps between politics and science could have been narrowed. So it was one of the success, one of the key of the success. But I think this kind of understanding is important. So I will talk about it in detail in the next slide. You know, so making the COVID-19 combating effective, we need to sensitive. So we have already established public health emergency management system since from the experience in MERS and SARS, but we still need to together make science and policy work and expert leadership, for example, the KCDC, and political leadership, for example, so central and local government. And the most important is citizenship. So citizens' cooperation and communication with the government, it is very important to go through this global crisis, especially in Korea. So I think it was overall effective in Korea. So talk about it more in the next slide. So I would like to summarize 4 keys in combating COVID-19. 4 keys. Firstly, we have succeeded in making private testing kit development, and the government within a week has approved public emergency use authorization. So we called it EUA. Secondly, there was systemized managing of COVID-19 spread by the KCDC and the central government. Thirdly, local government's cooperation and communication with the KCDC and central government. And last but not least, but I think this is the most important, citizens' cooperation and endeavor to follow the public guide and social distancing. I heard that, and I watched some news in many global news agencies. So recently, face mask is effective, but I think I'm not infectious disease experts, but watching the trend, watching the facts until now, I think it might have been effective. So, you know, social distancing. For example, in Korea, among family members, the family members, each family member tried to keep social distancing, but it is from not just medical advice, it is from one another's consideration, the other family members' health. So if a potential possible confirmation is expected for a case, he is almost completed, or he or she is almost completely isolating himself in his room in Korea. So such kind of social understanding and social endeavor to keep social distance was one of the important aspect of effectiveness in Korea and the other countries. For example, in many countries, I think not limited to Korea. So I'll talk about the related fact in the next slide. You know, plus this, there was big data platforms and apps. You know, we have run the public mask supply system. It was not, it was public, but the face mask was not free, but the government has tried to keep the lower price level. And government, for example, we typed public mask, public face mask in portal site, and then the portal site directly how many stockpile per pharmacy, and so we could visit in few minutes because we already know from the big data, government assisted big data, we can know how many face masks was there. And then the other case is the left bottom case is the apps made by a startup in IT startup in Korea. It is provided by free of charge to citizens. It provides public information screened traffic of confirmed cases. So, and in addition, it alerts big, based on the mobile phone user's location. If he approaches around 100 meters, the confirmed cases traffic area, it alerts each mobile phone users before reaching the space. So it is already public information screened apps. And I will almost we are close to the end, and I'll talk about it some remaining. So this shows the government's COVID-19 guideline. It is in Korea. In Korean, it is directly translated as behavioral rules. So we have made this kind of campaign leaflets and distributed it via online and offline. And this kind of campaign was successful, and the citizens cooperate and communicate with the government successfully. And one of the important aspects was, I think, social distancing. So in the next slide. Yeah. Thank you for your attention. I think the public attention is most important. Thank you.
Thank you, Professor Park, for your wonderful presentation. From your presentation, I think we have learned that the key of Korean responses to COVID-19 is a mix between effective expertise leaderships combined with political leadership, as well as the cooperation from citizens. And here, I think we also talk about citizen compliance in terms of following guidelines, including social distancing. You also mentioned some interesting fact from Korea, like for example, the uses of big data, and then how you deal with the with some micro policies, including how to make sure that family also at home follows the government guidance in dealing with this COVID-19. Before we move to Q&A, and I think I will also like to announce to participants that you can propose the questions through the Q&A icon below at this Zoom application, as well as from YouTube channels. Our staff at CSIS will import the questions from YouTube to Zoom. While we are waiting for questions to come, we already have 3 questions in a row. We want to hear the insights from Ambassador Umar Hadi about the real situation there in Seoul, about your experience, and even dealing with your duty, and for example providing protection and make sure that all Indonesian citizens are safe and sound there in Seoul. Please, Ambassador Umar Hadi, the time is yours.
Thank you, Andrew. And I should also like to thank Pa Philip for organizing this seminar. And of course, I am very grateful for Dr. Gil Park for his presentation. Perhaps I will not comment on the presentation, but I just want to say something about why I did not evacuate Indonesian nationals from Daegu. Because if you look at the timeline, January 23rd, China announced lockdown in Wuhan, right? And on the 2nd of February, the Indonesian government evacuated 238 Indonesian nationals from Wuhan. Here in Korea, February 21st, the Korean government announced the Daegu as special care zone. And mind you, during that time in Indonesia, we had not had any idea about whether or not the outbreak of this COVID-19 would happen in Indonesia, right? We were still debating on that. So at the time, on February 21st, the pressure to the embassy and myself as the ambassador was very, very strong to quickly evacuate Indonesian nationals from Daegu city. And we have about 1,400 people there. Most of them are migrant workers, and there are about 80 students. So why I didn't decide to evacuate Indonesian nationals from Daegu? So I used 4 parameters, right? Number 1, the level of information transparency. And as Professor Park explained, since day 1, I still remember January the 20th when the first case in Korea was announced. I think the health authority, public health authority in Korea already committed to adhere to this transparency principle. And we follow every day. I think twice a day, the KCDC, Korea Center for Disease Control and Prevention, made a public announcement about the number of new cases, the number of patients, and so on and so forth. Very transparent. And this announcement is directly broadcast by all TV stations, even one in English by Arirang TV. I watch them every day. So the high level of transparency. Number two, whether or not there is a high level of preparedness, especially when it comes to public health authority. So since day one, the embassy has been working very closely with the KCDC, for example, to form our educational messages to our nationals in Korea, because most of the 30,000 Indonesians, 37,000 Indonesians living in Korea, most of them, they don't speak Korean very well, and they don't speak English very well. So we have to really work translating the public information and public education campaign from the KCDC to our nationals. And through that process, we learned very early that the level of preparedness on the side of the Korean Public Health Authority is very, very high. They are prepared with the number of doctors, the number of nurses, the number of beds in hospitals, the number of testing kits, the number of all kinds of medical equipments and supplies needed to mitigate the spread of this coronavirus. And we learned also very early that they have done their homework, learning from the previous cases like the MERS, SARS, and so on and so forth. And number three, we also look at the level of policy coherence on the side of the Korean government. And we learned from day one that, well, I think the first 2-3 weeks, there was some kind of, not incoherence, but there were debates within the government, as well as between the government and the parliament. And then also there was, at one time, there was a debate about why the policy of the government only prevent the incoming visitors from Wuhan and Hubei and not the whole China, for example. So the first 2-3 weeks, there were debates. But after, I think as soon as the president of South Korea announced the highest level of alertness, the red alert, and everybody, I think, came to one stage, and then there has been since then a very high level of policy coherence. And one of these, the most important policies which has been very well maintained by the Korean government is the no lockdown policy. That's why in Daegu, even in the height of the crisis, I remember on February 29th, in one day, there was almost 1,000 new cases in Daegu city, and the call for some kind of lockdown was very, very strong. But I think the government was very strong in defending their policy, and I think it works out very well. And last but not least, number 4 is that we are looking at the level of public trust to the capacity of the Korean Health Authority. And we can see today that how this public trust really is in the right place. So that's why today I can say easily that this is why I did not evacuate my fellow Indonesians from Daegu city. But during those days in February, you could imagine it was not very easy. But thankfully, our working relationship with Korean Health Authority, the KCDC, with the local governments in Daegu City, with the local government in the province of North Gyeongsang, and also our relationship, of course, with the Ministry of Foreign Affairs has been very, very good. So we could be very confident in helping, assisting Indonesians living in Korea to navigate through this public health crisis. So instead of evacuating our nationals from Daegu City, we decided on the February 27 to set up a liaison office in Daegu City. We sent in 10 people from the embassy to work in Daegu, and they work closely with the local authorities there, especially during the scarcity of face masks in Daegu. We managed to help distributing directly to Indonesian nationals about more than 50,000 face masks, also hand sanitizers, disinfectant spray, some food stuff, and so on and so forth. So all in all, I think the success, I don't think it's too early to say that Korea has been successful in navigating through this public health crisis. But also I can say that Indonesian nationals living in South Korea, they are safe and in very good hands. Thank you very much.
Thank you, Ambassador, for highlighting the point. From your comments, from your remarks, we learned that there are some reasons that that makes you decide not to evacuate Indonesian citizens from Daegu City, regardless the outbreak that recently occurred there. Among other things include the transparency and the high level of preparedness in terms of public health, and as well as the public trust. And we also highlight some points, including that the Korean government is not applying lockdown policy as occurred in some other places in the world. This is also to answer some of the question that has been coming in regarding the lockdown policy, and probably we can talk about and discuss more about this later with Professor Park. Some questions are coming now, but I would like to pick one from Nurtria Rendi Rahmadi, asking about the possible reinfections of the recovered patient of COVID-19. How do you think the current attitude for this, probably the next unknown? How do Korean government prepare for example, another wave, another hits, or another infection from already recovered COVID-19 patients? Do you think that this is also it's also already included in the current contingency plans built by the Korean government?
Yeah, of course. Yeah, we Korean government, for example, the National Assembly and government has passed the budget, additional budget for combating COVID-19, but for example, the preparation for the possible next phase or next wave of COVID-19 is almost, I think it is good. For example, we have prepared a system to making protective equipment, especially protective clothing for that is used in medical purposes, about 2 million per month. And the other aspect is already mentioned, budgeting. It is quite sufficiently. I think it is not. This is not the time to evaluate it was sufficient, but it is not. I think I expect it is not deficient. So such kind of financial and some medical preparation is the key, the central aspect of Korean preparation for the next phase.
Okay, thank you very much for your answer. And another question is related to lockdown. This is a very basic question. What do you think about lockdown policy that has been implemented in other places in the world? Do you think this is a good responses? This is a good policy, or if probably Korea also think about this? What do you think about lockdown? Why it has not been implemented until today now in Korea?
Yeah, okay. In my view, Koreans tend to be social. So as already well known, compared to the Western society, Asian society tends to be more social, and this sociality makes some good aspect, and on the other side, bad aspects. But to combat COVID-19, I think social aspect was important. And for example, we tried to keep social distance, and as I mentioned, try to keep social distance even in a home, each home. So I think if we have no measure but urban quarantine, but I think it is not one alternative. Before urban quarantine, I think if we have a good attitude and good social perception about social distancing, I think before urban quarantine, social distancing is much more effective.
Andrew?
Okay. Yes, Ambassador?
I think just to add a little bit on what Professor Park just said, also information technology. I remember when I went to Daegu on February 27, in my handphone, I think about 70 kilometers before entering the city, I already received SMS in my handphone. Okay. Beware, you are entering the city of Daegu, province of Gyeongsangbuk, where a lot of cases. So, with that kind of constant reminder automatically in our handphones, so we don't need lockdown basically, because you can help yourself to navigate the situation. So now, for example, in the city in Seoul, we get notifications from the local governments. For example, we live in Yeouido area, so I received notification from 3 different local governments around my area. So it is not limited to only where we live. So we can navigate this, and of course the very high level of awareness from individuals is very important.
Yes.
Okay, thank you for your additional remarks, Ambassador Umar Hadi. Yes, Professor Park.
Yeah, it is of course. I very much agreed with Ambassador Umar Hadi. So but we have provide such kind of information, for example, via web or through SMS. We have screened and public information, and we have tried to manage such kind of public information, including location. We have tried to manage, for example, if needed some public personal information for that can be potentially distributed to some private or other relevant sectors. We have completely received agreement from each person. Okay.
Okay, thank you for your answers. I think we have three kind of questions now. First is related, first group of question is related to how the micro policy has been implemented by the Korea. For example, the uses of ICT, the uses of mask, and the application of social distancing policy. And there's also another questions related to how the governance structure has been established in the wake of this COVID-19. And the last group of question is related to the political questions. I would like to at least try to exhaust the first group of the questions, starting from the one from Liliana, who's been asking about the policy to suggest citizens to wear masks even the way long before WHO issued recommendation. Do you think that this already contribute to the low cases per population in South Korea today?
Please restate your last question again.
About wearing mask in public. Do you think this is an important factor in Korea to help contribute to the making of low cases per population in South Korea?
Okay, wearing a face mask in the public, I think it was in light of the trend of the cases, and not just about the confirmed cases, but death rate and the other medical case number. I think it, to state this more scientifically and in terms of medicine, it is not. It would be early for we to determine the effectiveness or the causation of face mask to prevent more spread of COVID-19. But anyhow, until now, Korea is one of the most effective combating to COVID-19 country. So I think in light of this is behavioral and social aspects. So I already mentioned the individual understanding to individualistic understanding to wearing face mask. But wearing face mask is not just protecting me, but more importantly to protect others. So Korean have understand this, and in light of and hearing the government message and campaigns that understand. So actually, we know we have not, because COVID-19, we have already know some aspects of COVID-19, but we don't know actually how atmospherically and through the other channels. I mean, channel is not the medical terminology, but in this term, I would like to include some social meaning. So wearing face mask from the perspective of policy analysis, I think it was effective. And even in homes, if one family member has been evaluated by as a possible potential confirmed cases, he or she tried to wear mask in a home. So I think it was effective, and it's kind of social and public understanding matter.
Okay, thank you very much. We also have another questions regarding the challenges and especially the challenges of implementing social distancing policy. Do you think that Korea government or Korea in general has faced necessary challenges in making sure that all citizens apply social distancing effectively and wisely?
Yeah, I think the government leadership was important in this aspect. I mentioned two kinds of leadership. One is expert leadership. The other one is political leadership. So central government has a kind of Adam Smith's division of labor. This kind of division of leadership. So the government has successfully made its political leadership and the KCDC and the other experts, but I don't think the government, the central government, has listened to all the advices from the medical society. But the KCDC has good authority, so the expert leadership of KCDC was very successful in leading social distancing and wearing public masks, and the other aspect, for example, complying with behavioral rules and listening to government's updated information, even based on each mobile phone users' locations.
Okay, one more question from Fadli Jihad Setiawan related to technical aspects of the Korean responses to COVID-19. This is about the quarantine that in some other places has been applied for those who move across borders to inside Korea. What happens to them? Do you also apply this kind of 14 days quarantine for those who recently came back or arrived in Korea from overseas?
By quarantine, you mean isolation, personal isolation, or?
Yes, applied sometimes to those who traveled from outside Korea. Do you have this kind of policy to make sure that there are no imported cases that will contribute to high level of COVID-19 cases in Korea?
Yeah, of course. We have, as I suggested in my presentation, three kinds of procedure. So exposure and infection, and screening and testing. The last page is isolation and treatment. So each process is very important. So I think if we cannot actually screening, for example, at the airport, all the cases, because this COVID-19 has a latency period, so this during this incubation period, nobody knows, so we cannot screening everyone at the entrance from the airport or harbor, but actually to be more sensitive is a, I think, good approach, because if somebody has a fever surpassing some government criterion, I think some level of quarantine or isolation, but guided by the government and provided by by the government, I think it will be necessary.
Okay, thank you for your responses, Ambassador Omar Hadi. Do you have any more comments on the technical aspect of Korea's responses, maybe based on your experience?
Number one, on preparedness. For example, on the face mask. In South Korea, wearing face mask is not something new, because from time to time here we do have what we call fine dust, right? So there are days when the pollution level is very high, and everybody should wear face masks. So wearing face mask is always something that the people here used to. Also, the information that we get through our handphones in times of emergency as a public service, it is not also new. It has always been there. So for example, when we have this pollution, the fine dust, we will get a notification in our handphone from the government about the level of pollution, and then we are, I think we should not take our private cars. Instead, we have to take public transportation, for example. So that kind of preparedness on the level of the society has been there in Korea. So that's why, in terms of crisis, COVID-19 crisis now, perhaps it is much easier to do that in South Korea compared to other countries where you don't have that kind of level of preparedness in your society.
Okay, thank you, Ambassador. We now move to the group of questions related to the governance structure. Professor Park, you mentioned something about a division of leadership between expertise and political leadership, but there is one question from Andi Firmansa. He's asking about how the governments of Korea and ministries coordinate with each other. He's asking about interagency coordination between differences government agencies relevant to the policies. How does it happen in Korea now?
Okay, for example, the local government has successfully communicated with the central government. So each local government has its own team or person in charge to communicate with the central government. So I think it was very important. And then of course, between the central government and the KCDC, there is such a kind of similar system already established. So I think communication and the persons in taking charge of communication among central government and local government and KCDC was very important. And we have already established this kind of communication system via online and via the phone, and in some cases via meeting. So I think this kind of communication is the basis of effective cooperation.
Okay, thank you for your responses. We have another questions related to the intersection of the responses for these COVID-19 cases to other sectors of policy, like for example to economic sectors and social protection sectors. We have one question from Ariandi Saras from YouTube. He's asking about the fact that 70% labor forces in Korea are working in service area. How the Korean government is planning to make sure that the labor productivity is recovering as soon as possible after the virus subsides future.
Okay, I think the inner question is a bit unstable, but in Korea we have a good economic management system led by the ministries relevant ministries. But I think it is not sufficient by the government leadership, because economy is mostly private sector, and the government has take a role in mediating this kind of business activities in the private sectors. So, of course, we have already made additional budget, but, to make effectuate, in Korea, we have already began providing some finance to each household, and some measures to elevate labor productivity, because we have experienced recently unemployment rate increase. But the more aggressive and more cooperative attitude with the government in the private sector, I think it will be important. And for example, although we have experienced the hard situation for citizens to work in the workplaces on site, but we have tried to alternatives, as in many other cases in all over the world, via assisted by ICT. So as we have now done via Zoom across the Pacific. And I think, so for example, I'm at our university, Daegu University in South Korea, but we have rapidly adapted to this kind of situation. And I think this is a threat, but opportunity. So to make this threat, to make a more adapted services in economic sector, and the government needs to assist it ICT-based business activity more. I'm not mentioned limited. This is limited to ICT industry. ICT-based economic activity would be more important in the future.
Okay, thank you, Professor Park. Yes, Ambassador Mahadi, you'd like to add comments?
Yeah, just the last point made by Professor Park. I think online business, online-based businesses will boom in South Korea. Actually, this is something that has been kind of stalled. But after this crisis, I think online businesses will have a very good year. But it's very interesting, and perhaps Dr. Park we can discuss this later on. But I just had a meeting actually with the CEO of CGV this morning. CGV is a company that runs movie theaters. Right now, they are in a very, very bad place now, because they don't have demands. Nobody goes to movie theaters now, and they don't have supplies. Nobody is producing film now. So, and every month they still have to spend quite a lot of money just to maintain their presence. And he told me that, the CEO told me that two components are very important in this monthly expenses. One is the salary to their employees. Number two is the rent. So they have to pay rent. On the rent part, they can save a lot, because in South Korea, the landlords are now give lower rent, and then for those landlords that decrease their rent, they can get some kind of compensation from the government. Okay, and on the labor cost, they negotiate with the labor union in the company, and actually now they pay something like 70% only for their employees. So from that two elements, they can save about 40% of their expense, monthly expense, with the hope that they can survive without any business activity for 3 to 4 months. So this is a very, very interesting case.
Okay, thank you, Ambassador, for your comments. We have another one more question related to governance and policies from Arinda Nityasari, asking about the policy on social protection. How do you deal with vulnerable social groups in the time of COVID-19 like this? Like, for example, to those of elderly, unemployed citizen, and homeless citizen in Korea. How do you deploy specific policies for them?
You mean specifically, please restate the last sentences. What specific social aspect?
On specific, on vulnerable social groups like elderly citizens, homeless, and unemployed citizens. Do you have any specific policies directed to these vulnerable groups?
Yes, the government has some more selective provision to elderly or more affected group of people. So, you know, for example, we have each local government, depends on local government. Each local government has tried to provide some finances to each household, but it is limited to some level of annual earnings. So if some household exceed that level, they can not receive such kind of public provision to assist their living and helping their economic activity. So, you know, I think this kind of approach is the middle of universal selective welfare. So I think it is not completely accurate policy, but government tried to find each good, effective criterion to make their financial assistance more effective.
Okay, thank you for your answers. The next group of questions is related to the political questions, and one of the most important questions we have today is related to the uses of ICT to tackle these problems. Government, like for example in South Korea and some government as well in Southeast Asia, has increased their ICT capacity to help, for example, adopt a big data analysis, big data technology to track and publish the spread of the risk of COVID-19. At the same time, there are also, concerns, like for example, asked by a participant here, Liliana, asking about the risk of the risk towards privacy and data protections. Government everywhere in the world, somewhere in the world, has used digital means to track movement of their citizens. And does Korea also do this to the citizens? And if yes, how do you make sure that this not someday will become, another draconian measures perpetuated after the end of the COVID-19 to track movement of the citizen, to extract data from their activity and so on and so forth?
Yeah, of course, the government has a responsibility to protect citizens from their personal life, and for example, from this painful experience, we need to develop more good usage system of control system of crisis. This should be not public surveillance of confirmed cases and possible confirmed cases, so from this experience, we have made some systematic management of personal information, what level, and how to use some confirmation information, the other medical or location-based information to protect. The most important is to protect the further citizen from the spread of the virus. So I think from this experience, from all over the world, I think we can, for example, make management system even cooperated by internationally. So I think nationally and locally, local government, central government, and for example, between two countries, I think this kind of cooperation will be important.
Okay, thank you for your answers. Another question is related to political economy in Korea. This is one of the interesting questions we have today from Johannes Ivan Adi. In market economy like Indonesia or like South Korea, sometimes big business play important factors in ensuring that the whole governmental policy is being implemented effectively. How does Korean government work with big businesses in Korea to make sure that there are some concerted efforts, not only from the political side, but also on the economic side in dealing with these COVID-19 problems? Do you think that big businesses is the key factors?
Yeah, I think Korean big business try to make further COVID-19 spread occur. For example, if one cases, even possible cases, potential, I think the division level is not actually locked down, but even it is quarantine, and this infection services has rapidly made. So and then confirmation is occurred on immediately the whole building by the run big business is almost quarantined. So I think thousands of people working in that such kind of building, it is completely quarantined, and the business activity is to be changed into online activity. And for example, Samsung provided a residential treatment center in around the Daegu area. And our university has tried to provide some facility, but for example, this kind of private sectors. But in our university, facility is not very big, so the priority was given to Samsung. So this kind of a private effort was very important, and I think the private sector overall comply and cooperate with the government.
Okay, thank you. Another factor of compliance would be from citizen, and we here also talk about the state-society relations in order to make sure that the policy is effective. We have one question from Mr. Vidyandika Perkasa about the role of culture in shaping the public trust or even compliance towards government policy. Is there any specific traits of Korean culture that allows this kind of effective compliance occur in Korean society? And I think there are also some questions, like for example from Benedicta Trixie about the obstacles from the citizens to support the government policy. Is there has there been any kind of challenges from citizens, like for example, opposing the government initiative, not doing social distancing, or preferring lockdown instead of other policies? And also another question is related to how the society, work together in this COVID-19 problem. Do you have any cases related to social stigma against those who has been confirmed positive for COVID-19? So all this kind of societal and cultural aspect is also important for our lessons today. How do you respond to these questions? Probably the first is from Mr. Vidyandika about, is there any specific traits of Korean culture that has been instrumental in realizing citizens' compliance toward government policy?
Yes, we have tried to, for example, the government has reported the confirmed cases as a number, confirmation number 1, confirmation number 2. But actually, even super spreader, as for, but I think a citizen tried to make their understanding more scientific, because some suspected super spreader, but it is not scientifically proved 100%. So citizens tried to keep concentrated on their attention to how to make prevention further spread by their own effort, not others. So I think such kind of approach, of course, in family table on dining, they talk about it, some super spreader, possible super spreaders behavior, but when they are public, people try to do not make further social stigma, and try to keep concentrated on the kind of confirmation number 1, confirmation number 2. But they try to not to blame, but how concentrate on how to keep distant from their traffic, and in complying with the government guidance.
Okay, thank you for your questions. I believe we have answered questions from Mr. Vidyandika and from Ms. Benedicta Trixie and from Ms. Anissa Devi Rahmawati about stigma. Yes, Ambassador?
Yeah, I just want to add 2 points. One, I don't think there is such a thing as a cultural trait when it comes to compliance by the public. I happen to know that Koreans love freedom. They don't want to be confined in a place. They want to go out, socialize. They want to go to restaurants, bars, every day, every night with their friends. So, but as I said earlier, what is important here is, one is transparency from the government side, right? So that the population, the citizens, they can have a well-informed thinking, so they can decide for themselves what to do. For example, when you have a new case, right? So when someone is tested positive with COVID-19, then the authority will interview that patient. Where have you been in the past 24 hours and then in the past 4 days? And then from that interview, the local authority can pinpoint which are the places where the patients had been going. For example, day 1, he or she had lunch in this restaurant. So and we, the population, the citizens, we get that information almost in real time. and we can decide for ourselves whether we want to go to that place or not, because from a very open and transparent information. And I think in part that also prevent stigmatization. So basically, because you know what is going on around you, then you don't think the danger will come from other people, but the danger will come from yourself. So that is perhaps the best way I can describe that phenomenon. My second point, one of the most vulnerable parts of the society in Korea is the elderly. As you know, Korea is an aging society already. And during this crisis, there have been cases, they call it mini outbreaks, in elderly homes, in the senior homes, in cities like Daegu, Busan, Seoul. And when I talk with these people, the management of these elderly homes, one of the problems that they have is that the fact that they don't have enough caregivers. Not nurse, but caregivers. This is in the United States, we call them certified nurse assistant, CNA, right? In South Korea, it is very clear that these elderly homes, they don't have enough number of caregivers. And this is one thing that we will follow up also with Professor Park in the immediate future. Why don't we do something about it, provide education and training to young Indonesians so that they can work in South Korea as caregivers for the elderly. Thank you.
Okay, we are approaching the end of our seminar, and I think I would like to pick at least 3 questions from the box. I think this is all interrelated questions from Trustan Yu about the new Southern policy implication of the COVID-19, and from Dian Fabian about the possibility to replicate the Korea responses to other government, and from Fajar Hirawan asking about what Korea would recommend Indonesia to do. We still have another question related to political aspects, like, for example, how you deal with the oppositions, and is another election is a factor. Maybe if you have time, you can also cover this. But I think one of the most pressing questions today is what kind of lesson we can learn from Korea. Do you have any specific recommendation? I know that from the very beginning you mentioned about Sun Tzu, we have to know ourselves, but at least some comparative lesson would be also instrumental here. So if there is any important lessons from Korea that could be replicated here in Indonesia, what would be your suggestion? And is that suggestion probably would be effective to sort of revise and revisit the current platform that Korea government has for Southeast Asia, namely the New Southern Policy? Do you have any comment on this?
Yes, I have not known in detail Indonesian situations and its capacity and its system to combat COVID-19. But basically, from experience in Korea, I think the most important thing is, public attention and cooperation. So, the citizenship is most important. I think, Indonesian government has already been developed as a democratic, and it has good, strong leadership. But cooperation with the central government, between central government and local government, it is but political leadership. Yes. So I already know the special task force for combating COVID-19 is already established, and it's actively tried to manage this crisis. So the central government tries to listen the experts, and the citizen try to listen the harmonized voices from effectively harmonized voices, central government, local government, and expert leadership. So I think this kind of systemized cooperation and communication will be the more effective. This is not limited to virus cases. I think in many policies commonly applicable.
Okay, thank you very much, Professor Park. We have reached to the end of our seminar. Is there any final remarks that you would like to make now? Probably you and Ambassador Omar Hadi, and probably later Pak Phillips.
Yes, or for me, I think we have reviewed some recent important experience, but I believe Indonesia and other countries in the world have their own good competitiveness. In Korea, we try to keep social distance, and we try to communicate and cooperate. But there are the other good aspects in each country. So we try to find and develop and listen to the expert, and listen to the private sector, and listen to the citizen. So the government leadership, it need to be concentrated on government has compassion. Compassion means together and feeling. So government at the earlier stage of this outbreak, government tried to understand people's fear, people's anger. So try to comfort them, and based on such kind of government compassionate attitude, many other alternative synergistically can be developed by the private sector and the experts and the government. So most good, I think Indonesia can make the most impressive example to be applicable to the other countries. And I think ICT and big data based, for example, georeferenced data is, I think, important for combating COVID-19. So big data, georeferenced data, I think the government tried to make some good system of managing and constructing to combat COVID-19 at the government level, because I'm an urban management expert. So I think this kind of geo-referencing approach and big data approach is important for combating COVID-19 in the long term. And if the government and some experts try to build such kind of system, it will be helpful for the other unexpected viruses or epidemics, and the other economic or social risk, and further disaster. So I think this kind of two issues would be important for Indonesia.
Thank you, Professor Park. Ambassador Omar Hadi, for your final remarks. Can you give us some final insights? And probably, if you may, please also touch upon the question about the future of Indonesia's Korean relations, especially in dimension like, for example, economics. Please.
Yes, thank you, Andrew, and thank you, Professor Park, for your insights. I just want to underline what Professor Park just said, but to bring it to the global level. I think today we really need a global governance that, as Professor Park said, that has compassion to the people. So this is, I think, a very how do you say? This is the challenge of the day. How we, the citizens of the world, can push our government to behave and to act in a way that global governance can be inclusive and compassionate to the daily life of all human beings. Therefore, I think the principles of solidarity among nations, the principle of cooperation and collaborations, and then multilateralism, we need to really push forward on these big ideas of humankind. And I think this spirit of solidarity and compassion and collaboration has been in place, thankfully, between, in particular, Indonesia and South Korea. Our two governments have been working very closely since January, February, in terms of this COVID-19. We have been sharing experiences. And now even the Korean government has announced that Indonesia is one of the priority countries for the export of medical equipments and necessities from South Korea. And then moreover, the Korean government has also dispatched a number of medical equipments to Indonesia, and they will soon also deliver in-kind donation in form of PCR test kits. Now, looking forward, I think this special relationship between the two countries is a good basis for, in the short and medium term, to work together on the recovery stage. I know from experience that South Korea, from time to time, is always a champion when it comes to recovery. You know, after the economic crisis of 1998, South Korea was the first country to recover from that. 2008, also from MERS, from SARS. And I believe, I'm confident that this time South Korea will also be one of the first country to recover economically, socially, politically. It's just in their DNA, I think. But then the challenge here is how this recovery would also be some kind of jump start for others to also recover very soon. And this is a big challenge. I have been, for example, in a discussion with the business leaders here, chairmen of these big companies in Korea, and I think they have that kind of global outlook. So this is what makes, I think, one of the traits of Korea when it comes to this kind of issue is they always have a global outlook. They don't think only about South Korea. They are thinking about the overall global linkages. Of course, we can understand that because 70% of the Korean economy is dependent on international or global trade. So for us, global supply chain is like is very important for Korea. That's why the business leaders here, they have to have a global outlook. And this is, I think, one point that Indonesia and South Korea can work together I have been discussing also with Professor Park about, for example, how to stabilize the supply chain, the supply value chain, utilizing what kind of resources that Indonesia have, and on the other hand, the Korean. Number two, as I briefly mentioned earlier, also to look at these medical professionals, doctors, nurses, caregivers, as an asset that if we combine between the resources from Korea and resources from Indonesia, we can have these medical assets, as many as you want, and we can even have a joint export of these assets of medical professionals with high standards. Number three, we have been also talking about public health equipment as a special industry that perhaps in the next few years will be very, very important, because as we can see today, there is no supply. The supply is simply not efficient because the global demands is very high. So, for example, production of PPEs, protective equipments for medical professionals, also production of ventilators. As I just learned today, actually, in the world there are only about 20 something companies that produce medical ventilators with global standards. And one of them is in Korea, a Korean company, only one. Some of them in China, some in the United States and Europe. So how can you have enough production of this very critical medical equipment if there is not enough companies producing this equipment? So this is the areas that we are looking at now, and hopefully we can follow through. Thank you.
Thank you very much, Ambassador. You already have given us the new idea for another seminar and study. Thank you again, Professor Park, Ambassador Umar Hadi, for your wonderful insights. And I believe we have learned so many lessons from today's discussions. And I would not like to conclude anything, as I believe we can also replay again this seminar in CSIS YouTube channel. And I would like to give back the forum to Pa Philips Fermonte, our Executive Director. And thank you very much for joining today's discussion.
Thank you. Yes, thank you, Andrew. Thank you, Professor Park and Ambassador Umar Hadi. I take from the last point made by Ambassador that that's the reason why CSIS is doing this, to remind our Indonesian friends that we need to look beyond our borders and to learn from other countries. And that, I think, has always been CSIS mission. So thank you very much, everybody, and especially to Ambassador and to Dr. Park. Kamsahamnida. Thank you.
Thank you.
Kamsahamnida.
Kamsahamnida.